What would I say? I'm not sure. Like, you're going to be surprised what happens. Because I think back then, I had no idea what I was going to do with my life for sure. Didn't know I was even up in the air about college. No one in my family had ever gone. And so, yeah, I would just say, hang on, it's going to be a wild ride.
Did you anticipate it being, as you got into it, was the path still all over the place, or did you finally kind of find a center?
Yeah, I think in college is where I found my center, yeah. Had some really good mentors and got into research. That's where I really found my passion for research and science. And, in high school, I hated science with a passion. It was my most disliked class. And then when I got to St. Olaf, that's really when science came to me and it clicked and kind of took off from there.
Why do you think that is, that you dislike biology so much?
I think the teacher wasn't great, but beyond that, I was just a floater in high school. I didn't apply myself, definitely. I was a B student, just getting by, and probably did like the least amount of work to get by,
So what do you think happened in college that it clicked?
Yeah, so when I got to college, I was definitely super worried that I would take a few classes, drop out, and have tons of bills. So that was like part of it. I was like, if I'm going to do this, I'm going to have to do this hardcore. The other thing is I was lucky enough to get into one of the government TRIO programs, and that was incredible. Like without that, I wouldn't be here for sure. So the program was Student Support Services under the TRIO umbrella. They taught us how to study. They taught us how to be college students. Like that was super critical in getting me ready for the rigors of a place like St. Olaf, which I certainly was not ready for at the time. So that was huge.
And you didn't have someone that kind of helped you, guide you to that, right? Because you were, like you said, you were the first in your family in college. So there really wasn't somebody there that said, okay, this is what's going to happen, or this is what's going to happen.
I did have one mentor in high school, Frau Swadin. She was my German teacher. It was the only thing I was good at in high school and like really enjoyed was German. She happened to be an alumni of St. Olaf, and she actually helped me write my personal statement, put together my application, so huge support from her. Again, I think probably wouldn't be here without her support. So,
funny.
Yeah.
You found a new love in biology and chemistry. So why cancer? Why? How did it lead to that?
Yeah, I think everyone knows someone that's had cancer, passed away from cancer. It's just, it affects everyone. No one exists that doesn't know someone that's died of cancer. It's a huge unmet need, particularly in children who are like so innocent and just unfortunate to develop cancer. But yeah, I think that's it. Like, just it affects everyone, and I wanted to make an impact in something big.
Did you ever think when you started down that road, you just kind of went, how in the world did I get here? That's just crazy.
Yeah, it is. Because in undergraduate, I was just doing basic research. I was studying like tetrahymena and doing mass spec on molecules. And then I did do some research in the Czech Republic one summer during my undergraduate career. And there I started working on small molecules that bind DNA for cancer therapeutics. So that was my first experience in cancer research. And then when I started my PhD at the U of M, you typically rotate through different labs to see like what's a good fit. And so I did rotate through labs that weren't doing cancer, but then I landed with Dave Largaspada, who was really focused on pediatric cancer, and just kind of took off from there.
So how did the Shaver fund then? Why or how did it become critical for you when you were starting out doing all this?
Yeah, so when I started my lab in 2014, that's about when I started getting support from the Shaver Fund. And these small influxes of seed money are so critical to getting large national level grants that are, millions of dollars. So we've taken all of the small seed monies and we've turned them into large national grants. And honestly, if it wasn't for the Shaver Foundation, we would not be anywhere like where we are now in the clinic, treating patients. We've done really well with these seed monies and turning them into large projects and large national level grants. So it's been critical to our success of where we are now.
How unique is that to have something like that where a local, organization is able to give you funding.
Yeah.
That doesn't happen very often, does it?
No, there are very few, especially around Minnesota right now.
Yeah.
I think the really unique thing that I love about the Shaver Fund is they like to keep funding the same people that are successful. Because sometimes you can see these foundations, they'll fund them and see that grow into some larger funding. They'll say, okay, we've helped that person, we should help some other people. But I think with this foundation, they really focus on continuing to fund the successful researchers so they can grow and grow and grow over time. I think that's incredible.
You've had great success. Talk about achieving the 2 complete responses in patients and what that means to you.
Yeah, I mean, when I started my cancer career, especially developing therapeutics, I thought if I could cure one person of cancer, I'd be like life achievement, right? So yeah, like you're referencing at one of our spin-out companies from the University of Minnesota called Luminary Therapeutics, we've treated 4 different patients. They either have non-Hodgkin's lymphoma or multiple myeloma. And the first 2 patients achieved complete responses, which was like incredible. And it was the lowest dose of the cellular therapy that we've developed of a 3-dose escalation. And so that's, life-changing for me. I'm like, look, I've impacted real people, with disease. That's just incredible.
So you've impacted a couple of them. How do we get it to more people? How does that work?
Definitely, yeah. And in the laboratory, we're working on new cell therapies for lots of different cancers. And so one way is through the university where we launch investigation-initiated trials. The next one, we're going to be treating ovarian cancer using a new cell therapy we've developed. And that'll be the second trial at the university. And then again, we work with companies, and we've even started some companies where we're developing new therapeutics. And so we have, we know the formula now. We know what we need to do for a certain indication, and we have really great ideas of new therapies that we can apply to them. And so I think we'll be launching a number of clinical trials here in the coming years.
It's a little unusual for researchers of your age to have success so fast, right? Because you see some researchers who work years and years to achieve that kind of results.
Yeah, I've been very fortunate. I think I've, surrounded myself with really smart people, and I'm definitely relentless. Like I am just work, to get this stuff going because it's not easy. But yeah, I think I've been fortunate too, getting grant money. Sometimes there's a little bit of luck there and, depending on who you're collaborating with and things like that. So I've had very fortunate occurrences that helped this all transpire. It wasn't just like, I'm like super smart or something like that. Definitely some luck involved in just being relentless about, our research.
Do you ever wonder how life would have turned out had you not discovered your love of science?
Yeah.
Where would you be?
I'm not sure where I would be, but I can tell you one of the biggest decisions that was kind of a choice in my life was in senior high when I was applying to college, and I got accepted into this German program called the Bundescouncil, where you get to go to Germany, live there for a year, immerse yourself, but you skip going to college right away. And I was super worried that I wouldn't go to college if I took that year off, and I'd probably, I don't know what I'd be doing. Maybe I'd be in some sort of teaching in German or something, or just a random job, I'm not sure. But that was a huge fork in the road, and like that decision was the best decision I made.
Wow. You've made a lot of progress, but there's much more to do, isn't there? I mean, you've made a lot of progress in what you do, but as you said, the work's not done.
No.
Talk about that aspect of it.
Yeah, I mean, in our laboratory, we're working on numerous different cancers, solid tumors, adult, pediatric, and all of them have in mind from the beginning, how do we get this new therapy into the clinic? And so I think our goal over the next 10 years is to launch at least 5 new clinical trials for various indications using engineered cell therapies, immunotherapy. So we definitely have a lot to do, but the field is getting at a very exciting point where we're starting to see frank cures in patients with metastatic advanced solid tumor cancer. So it's a very exciting time, but definitely we have a lot to do, and we have high ambitions.